Well, if you suffer from knee and hip pain, help could be on the way in the next 5 minutes. Joining us now is our sponsor from the Core Institute, Dr. Stephen Myerthal, telling us about a new treatment option that may actually get rid of the pain and help you kind of regain that quality of life that so many people lose out on. Welcome to the show.
Thank you. Nice to be here.
I want to talk a little bit about basically the process that's involved with knee and hip pain and some of the things that we should be looking for that would cue us into the fact that perhaps we need more invasive measures taken to get rid of the pain.
Well, in general, it is pain. It's pain for the hip. It's usually located up in the groin or in the buttock or in the upper thigh. Knee arthritis is generally pain that's in the knee. Interferes with people's activities of daily living. They find it difficult to go on walks, find it sometimes difficult to dress. Sometimes have pain at night that keeps them awake and stops them from sleeping, and find that they have to take more and more medication of generally stronger and stronger types in order to alleviate the pain.
Well, I was reading some information, too, that said that a lot of times people have to go to physical therapy, and they try those kinds of routes of physical therapy and the medication to no avail.
That's true. Depending upon the level and the severity of the arthritis, oftentimes non-operative measures don't work. Joint injections, for instance, may give short-term relief. Physical therapy may give short-term relief, but people find that as time goes on, their symptoms are worsening.
So they know if you suffer from the hip or the knee replacement issues, then you know that the pain is severe enough to take more advanced measures.
In general, it's often patients that come to me telling me they need knee replacement surgery or hip replacement surgery, as opposed to me telling a patient that they need the surgery themselves.
And so that's when you come to them and you say, you know what, you may not need the traditional type of knee or hip replacement. And how does that differ?
Well, one of the techniques of hip replacement surgery that I've been using for the last few years is called the direct anterior approach, where we actually surgically approach the hip from the front of the thigh instead of from the side of the thigh. It doesn't involve taking the muscles off the bone. It involves parting the muscles. The surgery is much less invasive. Patients tend to get better much quicker after surgery as well.
And so what should they expect in terms of kind of regaining that quality of life and after such a procedure?
In general, it's a 2 or 3 day stay in the hospital. Their pain is less with this technique after surgery than it is with the traditional approach. Patients are usually discharged home or to outpatient physical therapy. They walk with a walker for a few days, then onto a cane quickly, then off of the cane within a week or two. In general, most patients are back at their normal level of function by about 6 weeks' time.
That's amazing.
Very quick.
And life-changing, no doubt.
Life restoring, get them back to the level of activity that they were at before they had arthritis.
Who's a good candidate for this?
In general, it's any patient that has hip pain, really, and if their hip pain has progressed to the point that it's interfering with their life, like I said earlier, and if it's, if they're pain and they're ready to move on to the next step, those are the candidates that are good for that.
Well, we want to let people know how they can get in touch with you over at the Core Institute so they can take advantage of this type of procedure that's going to put them back onto the path to not only to recovery, but to a better life, no doubt. So appreciate you being on the show. If you'd like to schedule an appointment with one of the fellowship-trained physicians at the Core Institute, you can call 866-974-2673 or visit their website, thecoreinstitute.com.